Good morning, everybody. It's Monday, the 17th of August. I hope you had a wonderful weekend, and we're excited to be back at work, and we're starting our COVID meeting. We wanted to share with you our daily video, and we're going to start with the board. We had a pretty good week. Let's take a look. Okay, so just a couple of things real quickly I want to look at here. This chart right up here at the top in the yellow, that's the number of new cases by day, and just look at where we were back on 7/18, and here we are on 8/12. Remember, this data runs several days behind, but you can see the clear downward projection, and if you overlaid a straight ruler from that high back on the 18th down to the 12th, you'd see a pretty steady decline. It is even more evident when you look at the resident deaths over that same period, and you can see that it has dropped off almost entirely. This is a graphic of the COVID cases per 100,000 population by county, and you can see here in Pinellas County where that sort of very light yellow. If you come over to the graph right here, it is the second to the lowest rate. We're averaging between 1,300 and 2,100 new cases per 100,000 population. You'll recall not that many weeks ago, we were the bright, dark, burnt orange. And currently, you can see the only place in the state of Florida that has that is a small county outside of Lafayette, and you can see for that county they had cases per thousand, almost 11,000 in a very small county. Total population is only 8,744. These are the four graphs that we look at every Monday, and the first thing that we observe is that every single one is headed down, so that must be good, right? The first slides on the left-hand side is the number of people. The top slide is presenting at hospital with influenza or flu-like symptoms, and then the bottom slide in the purple on the left-hand slide is those presenting at hospital with COVID-like illness. And you can see that both of them are rapidly declining. Up here in the right-hand corner with the yellow, these are the documented new cases of COVID. They are declining. And here is the good news. You can see this is the positive laboratory test. And last Thursday week, we had dropped below the target range, and we have continued to run below the target range since about the second day of August. So again, all good numbers looking at a global statewide perspective. All right, so we are in day 72 of phase 2. And let's take a look at the actual numbers in Florida. We're at 573,000 cases. It went up about 16,000 over the weekend. That was 8,000 per day, a little higher. But again, what we're more concerned about is not the number of people who are contracting the illness. We're concerned about that death rate and how well that's improving. So we're seeing fewer hospitalizations, and we're seeing a declining fatality rate. Those are the two metrics that are really worth tracking. And in Pinellas County, we have 18,594 cases with 548 deaths. That went up just 11 people over a 2-day period. Those are good numbers. Pasco County is stable, and in the United States, we are at 5,400,000 406,000 with 170,000 fatalities. The testing metrics continue to show steady day-by-day improvement. Here in Pinellas County, we're up to 180,000 tests, and the percentage of infection rate is 10.37. As you saw from one of the graphs, for the entire state, we are below the 10% mark, which is the benchmark. So here in Pinellas County, we are almost there. The hospitalization rate is about 18,000 for Pinellas County, and for our specific zip, we're at 344 cases that have been hospitalized. When we take a look at what's happening here at Regency Oaks specifically, the number of residents who are under quarantine in the independent living, we're down to 14. Last Friday, we were at 24. So these are the people that are either new move-ins or people who have come back from the hospital after a procedure and are in either strict or loose quarantine. In the AL, it is 0. In the skilled nursing, it is 10. So there are 24 people across the campus who are under quarantine. In our staff, there's no one in the IL. There's one in the AL and one staff member in skilled nursing for a total of 2 associates across campus that we're in quarantine and we're watching for symptoms. In terms of actual people presenting with symptoms, testing in progress. In terms of our residents, we have no residents in the IL, the AL, or the skilled nursing. And then in our assisted living, we have 15 associates being tested and 125 residents that are being tested as part of our routine bi-weekly. We go in and test every associate and every resident. So those numbers are high because of that preemptive testing that we do to make sure that our health center, both the assisted living and skilled nursing, is safe. And so those numbers will begin to clear over the next couple of days, and we should get back to zeros across the board. Essentially, right now, there are no associates or residents that we are monitoring for symptoms, and we believe that currently the building is safe. In terms of our confirmed cases, we continue to have 3 residents and 16 associates since the start of the virus that have tested positive. Our changes to visitation and staff access policies, there are no changes to announce today. Early next week, we will be looking to consider whether or not we can release the side doors in the IL. That will be based upon what happens this week and how those numbers change. Our social distancing, there is no change in our social distancing policy. It's up to small crowds with appropriate distancing and mask up to 50. Most of the resident activities have resumed with some normalcy, and we are getting ready to open up sit-down dining on the 25th of August, which is next Tuesday. Tomorrow at Tuesday Talk, I will be going through the specific dining restrictions, what's changing, what that is going to look like, and spending 15-20 minutes giving you a very specific, detailed analysis of what's changed and how that's going to impact you. Over in the skilled nursing today, we are doing additional testing. We had the Department of Health in the building over the weekend. They cleared us. It was a follow-up survey. It's the third time in 3 weeks that they've been here. They continue to be really impressed and complimentary of what a safe building and secure building it is. We've not taken a single citation, and as part of a follow-up, we will do some random testing that will be happening today. In our housekeeping changes to announce is Jesse will be doing Housekeeping Matters this week. It's his turn to be broadcast. So if you would come out and support him, give him a big crowd on Wednesday. That will be carried live. Will be rebroadcast at 1 o'clock on Wednesday. And Clearwater Carpet, they will be out here this week doing some work in the public areas. There are no changes in terms of transportation to announce this week. We are still using our transportation team to create the extra layer of security at our front doors, checking temperatures and running the security check for access. Tiffany has a couple of really exciting events this week, and be sure to check the calendar for that. I'll be highlighting them tomorrow in Tuesday Talk as well. Our PPE, personal protective inventory, continues to be solid. We have multiple weeks of supplies on hand should we incur an outbreak, and so we look good there. I know you read a lot of the articles where having PPE available to the staff, particularly in long-term care, has been problematic across the country, but I can assure you that Regency Oaks has an adequate supply. We've been very strategic in our approach, buying small amounts each and every week and allowing our inventory to build up over time, and we look really well. So that concludes our remarks for today. I hope to see everyone at Tuesday Talk. We will have the 5 thoughts published on Tuesday and Thursday this week. Jesse will broadcast Housekeeping Matters to be aired on Wednesday, and then on Friday we'll be back with the weekly forum. So that's the broadcast schedule for the week. I hope everyone has a wonderful Monday, and I'm looking forward to seeing all of you at Tuesday Talk tomorrow.